So as I say, welcome everyone. I'm here, I'm Savannah, and this is my colleague Jahan from the Health Anchors Learning Network. It's great to see introductions in the chat. Do continue to introduce yourself, say why you're here today, where you're from, because with the webinar function, we can't all see each other, so it's great to kind of get an idea of who's in the room. We've got about 60 participants now, so we'll get started and more can join as we go on. So welcome to Partnership in Practice, Health Anchors and the Civic and VCSE sector, hosted by the Health Anchors Learning Network. I'm just going to introduce Jahan as the tech lead today. So if you are having any issues, I know Zoom can be complicated sometimes, then do drop Jahan a message in the chat and she'll try and help you. If we can just jump on to the next slide, Jahan. That'd be great, thank you. So a little bit of housekeeping before we dive in. We are recording this session, which means that both the slides and the video recording will be available on Hound's website and our YouTube channel as normal. Because this is a Zoom webinar, it means that there's two kind of interactive functions. We've got a Q&A, so at any point just pop questions in the Q&A, which are for the panelists. We have some time for questions at the end, but it is a 60-minute webinar, so we'll try and answer kind of as many as we can get to. But if you want to have general kind of chat, comments, queries, share links, anything of interest, then you can pop that in the chat. So you've got the Q&A function and the chat. If we can just jump on to the next slide, we'll jump into the content for today. So HALN is short for the Health Anchors Learning Network, and if you're new here, we're a free organisation, a free network for anyone interested in or working in anchor approaches to health, but also partners, so that could include the voluntary sector, local authorities, etc. We share a monthly newsletter, which I would recommend that you join so you can hear about more events like this and all of our learning products and original resources, that kind of thing. I think we actually have now almost 1,500 members, and we have a social media, so please do join us, tweet us and get involved online. But we do public events like this. We also do closed action learning sets for people involved, and we promote good practice, and we're going to be platforming some great practice here today. We have a whole tools and resources page, so you can download resources there free of charge, and there'll be a resource we'll be sharing on civic partnership after this as well. And we host blogs as well. So that's a little bit about us. Now I'm going to dive into the content. So today we're going to explore how and when anchors can and should partner with the civic and voluntary sector in order to deliver value for local communities, because that's what it's all about and that's what it comes down to. And we'll be showcasing some really fantastic examples of this partnership work. The context of today is essentially that partnerships are absolutely central to anchor work and impact, as I'm sure a lot of you in the audience know. ICS policies are encouraging local partnership and collaboration. And this topic as well comes up a huge amount in HALN work, such as in our learning set conversations. But it's clear that navigating the complexity of partnerships is a really common challenge, especially considering the varied ICS structures. So today we have some people who are really good at navigating that complexity to talk, including Emma, who you can see on the right there, who's NHS England's Deputy Director for Voluntary Partnerships, leads on national policy on volunteering and the NHS's relationship with the voluntary sector. And prior to this, Emma led programmes connecting the voluntary sector to strategic decisions in health and social care. We have Dr. Hinnah Rafique, who you can see on the left there, who as an NHS doctor founded Generation Medics based on her lived experience. And Generation Medics is an award-winning social enterprise that works with local communities to co-develop solutions to support people from all backgrounds to explore and succeed in health, social care and STEM careers. So really exciting. And then we've also got Alison, Farah and Safia, who's not on there, but you will see her very soon. to speak about the Flourishing Communities programme. Alison is the Partnership Manager for the Tower Hamlets Council for Voluntary Services, where she supports the voluntary sector to link with the NHS and supports the development of the VCS Alliance. And you can see Alison and Farah there. And Farah and Safia are from the Women's Inclusive Team. And the Women's Inclusive Team is a female-led charity based in Tower Hamlets. So we've got a really exciting agenda for you today. And if we jump into the next slide, then our first speaker, Emma, is hopefully ready and raring to go. And I'll hand over to Emma now.
Thank you so much, Savannah. It's really nice to be here today and to see so many familiar faces in the participant list. So hi to everybody I know already. My name's Emma. I work for NHS England. You can tell this is an old slide because it says and NHS Improvement, and I haven't updated it. Yeah, I work for NHS England in our voluntary partnerships team, and our team really is all about trying to ensure that there are good and effective partnerships between the voluntary sector and the NHS. And so I was asked to speak about the value of cross-sector partnerships, which clearly I believe in because it's in my job title. But I also know that everyone who's joined this webinar will firmly believe in it too, because otherwise you wouldn't have joined. So actually my job's really easy today. I'm just going to tell you everything that you already know. So I will keep it really fast because actually I want to make sure that people hear from the two case studies that we've got as well. So if we go on to the next slide. So that was always worth just summarising the size of the voluntary sector as a reminder, in that it's obviously huge. This is a couple of years out of date now. I know that NCVO have just published a new version of the almanac, but the sector contributes a huge amount of money to the UK economy, has huge assets. There's 166,000 registered voluntary organisations in the UK, but actually probably far more, and a huge value of volunteering being brought in into the economy. And so if that's the case, then of course, why wouldn't you work in partnership with the sector? Because it's such a significant component of our society, in that so many people have accessed services delivered by voluntary organisations in one way or another. And everybody's in touch with people, everybody knows of the voluntary sector organisations, and it's so integral to the work that we do within health that there's a kind of almost why wouldn't you work in partnership question for me. And then on the next slide, this talks about social enterprise sector. So often we talk about the VCSE sector, the voluntary communities and social enterprise sector. The social enterprise part of that's even bigger, I suppose, in terms of the size of the number of employees that they've got, and it's worth £24 billion to the economy there. And within the NHS, obviously social enterprises make up a significant component of delivery of services within the NHS, with lots of organisations that are spin-outs from what was previously an NHS organisation. So if we go on to the next slide. So I suppose this is the one where I'd sort of say, well, why would you do it? You may, if you've heard me speak before, have seen that I've used a similar photograph to the one I've used before about a river. And this particular river, which I'm not sure I can say the name of, but is one where the bridge that you can see on the picture was originally built to span the river. And then there was a massive hurricane and lots of environmental pressures, and the course of the river changed overnight. And now, or after this, when this photograph was taken, the bridge spanned nothing. Still an incredibly good bridge, really robust and solid, but doesn't actually have really a purpose anymore. Now, I'm not saying that's true for the NHS, but there are parts of the NHS which are a bit like the bridge. It's been built for a purpose. It was set up nearly 75 years ago to serve communities in a particular way. And that purpose has changed over time. But sometimes the NHS is still a little bit like that bridge and is still trying to do the things of the past. And what we get when we work with the voluntary sector and work much more in partnership with the VCSE sector is a much more flexible and agile response that can be quick and adapt quickly to need. And we've seen that more than ever in the last few years, as I know people are aware of. And the sector enables us to really think differently about need. Within the NHS, we quite often talk about patients. Whereas in the voluntary sector and in the VCSE sector, we talk a lot more about people and communities. And obviously, when we think about people as people rather than patients, we start thinking differently. And the sector just keeps reminding us of that and keeps us grounded. Obviously provides reach into different communities and groups that we have. We know that the NHS quite often doesn't reach everybody. And so by working with the sector, you have that reach into different communities and organisations who are trusted by people that they work with. But it also gives us valuable insights. And over the last few years, I could count on more than the fingers on my hands a number of times that actually we received some really valuable insight from different voluntary sector organisations that we work with nationally, where the insight that was provided completely changed the course of the direction that we were taking. It has been really valuable, especially over the last few years, but always is the case. And then one of the things that I often reflect on is about the sector having formed or voluntary sector organisations in particular forming in response to unmet need. Actually, this is about people who go out and see that there's a gap in services and see there's a gap in the way that people's needs are being met, and form initially quite a small group and then lobby and campaign to become bigger because there is that unmet need. And actually within the NHS, we should be specifically about trying to identify how we better meet that unmet need all the time. And therefore the partnerships that we have with the sector are invaluable in making sure that we better respond to unmet need. Obviously the sector is diverse, and obviously the sector is incredibly innovative and creative. And we saw so much over the last few years where voluntary sector organisations were able to pivot on a knife edge almost, and went from delivering in one particular way at the beginning of March 2020 to a completely different way by April 2020. And the value that the sector has brought and the partnerships that were there as a result have been completely invaluable. But I think it's probably also fair to say that those things only happen if you have partnerships all the time. It can't be something that actually it comes to a pandemic or some particular crisis or other, and we suddenly think, oh my goodness, we need the voluntary sector. It doesn't work like that. And the things that were most successful over the last few years were the areas in which those partnerships were already established and already well established and working. So if we go on to the next slide, I suppose this sort of starts to talk about how, and I know that you will all have seen this image several times before, about the role of anchor institutions, and thinking about that role in relation to the voluntary community social enterprise sector. There are so many different areas in which the NHS as an anchor institution could be better working in partnership with voluntary sector organisations. So obviously when we're talking about things that you do more locally, actually working with local organisations provides that income and that support. There's also some very obvious ones about use of buildings. So within the NHS, we have hugely unoccupied spaces across the estate. That's not necessarily just that they're vacant, they just might be vacant at different times. And some of the most successful local partnerships that we see now are ones where the voluntary sector is making use of space at times that the NHS doesn't need it, and vice versa, to really be embedded in communities and be working together. Obviously, in terms of widening access to quality work, it talks about the NHS being the UK's biggest employer, but also if you add into that all of the partners that work with the NHS, including the voluntary sector, it's really, really significant. And so working with the voluntary sector to think about employment, thinking about volunteering as a route into employment, and all of those different ways of getting people into employment is really important. So if we go on to the next slide, I thought it was probably worth just putting in a couple of slides just so that you can read this in your own time if you want to. So there's links through to the new ICS design framework. We've obviously every few years the NHS reorganises its deck chairs and reshapes itself, and the latest is integrated care systems. And they are a new geographical area again, but trying to obviously bring together all of the partners who are involved in decision making around the wider determinants of health. And there is a real clear recognition in both the guidance on the design framework and the guidance specifically on partnerships with the VCSE sector about how the VCSE should be absolutely at the heart of, of how that operates at all levels, because it's so integral to everything. So go on to the next slide as well. This one just talks a little bit about some of the work that we've been doing within NHS England to try and support that as much as possible, because as we reorganise the deck chairs and as we change the geographies in which we work within the NHS, actually I don't think I know of a single voluntary sector organisation that pre the new landscape worked across the entire geography of something like West Yorkshire and Harrogate, or many of the other footprints that we worked across. And so so we've been working closely with a number of you who are on this webinar today to develop VCSE Alliances in every ICS that embeds the sector at system, place and neighbourhood level, so that to try and give a better way of statutory sector organisations being able to find the voluntary sector organisation that they need to work with on a particular piece of work, and vice versa. Everybody talks about that communication point as being that particular challenge, so to try and put that in place. And there's a video clip that you can have a look at there if you want to. And then I think the final slide, if I'm remembering right, is just a summary of other places, things that you can read if you are interested in finding out more. But importantly for me, the last point on there is our england.voluntarypartnerships@nhs.net email address. If you would like to take this conversation any further and have ask us any direct questions, particularly about what the VCSE Alliance looks like in your area or anything like that, then please do get in touch with us. And thank you again for having me today.
Thank you so much, Emma. I'm just going to move us on for the sake of time to the next speaker, but I just want to say that if anyone does have questions, and I know there's quite a few in the chat, then please do pop them in the Q&A and we'll try to get to them at the end. Thank you so much for that, Emma. Next, we have the Flourishing Communities team from Tower Hamlets. Thank you.
Okay, hello everybody. Thank you very much for inviting us here. My name is Alison Roberts. I'm the Partnerships Manager from Tower Hamlets CVS, and I'd like to introduce you to my colleague who is...
Hi everyone, I'm Farah Dualeh. I'm one of the Programmes Manager at Hamlets Inclusive Team.
And also our colleague who's on another panel, who is also going to introduce herself.
I'm Safia Jama, the CEO of Women's Inclusive Team. Really happy to be here.
And the Women's Inclusive Team is one of those examples of an organisation that pivoted during the lockdowns and actually supported a massive number of people in the community. Can we have the next slide? Okay, so we were applied for funding for this programme back in, we started in March 2019. We got the money in 2020 and then, no, 2021, it was last year. So after a bit of a shock of kind of trying to work out what to do after quite a long time, we started to look at where we wanted to be. And Safia is going to talk a bit more about the sort of research that we did. Could you press the next buttons, please? So, all of them, yeah. Oh, so go back one slide, sorry. Go back one slide.
Thanks, it's trying.
Yeah, no. This is where you have to. So we started off, this was a partnership between THCVS, WIT, the GP Care Group and Queen Mary's University, and also most importantly, the Somali community who gave their time to be part of the initial programme. I'm going to hand over to Safia, who's now going to talk a little bit about the history of WIT and what she did with helping us to actually identify what we were going to work on.
So lovely to be here. So for Women's Inclusive Team, it's been running for 19 years now. It's a registered charity based in Tower Hamlets. We have a focus in supporting Black and ethnic minority women, but a specialist Somali-led organisation. And I guess Tower Hamlets is quite unique. We're the largest second ethnic minority group, and we are the largest Black community in Tower Hamlets. I guess in 19 years ago, when the organisation established, it was very much about, I guess, lived experience of people that lived in the borough, that grew up in the borough, that saw what Emma described as the gaps in terms of services and needs. And it was our way of solving our own problems by creating Women's Inclusive Team, which is known as WIP. I guess we run a number of projects as an organisation. So we have an early years Ofsted registered department that provides free childcare for women that need it. We have a youth project that supports and empowers young people. We have a contract with ELFT, which is a 5-year contract around mental health, prevention of deterioration, but also helping people in a crisis. And then we work really closely with Bart's Trust around community engagement. And I think definitely when, and many other things that I guess we don't have time to go into now, but I guess in COVID, when we had the Black Lives Matter in COVID, it really highlighted to stakeholders and the community that more needs to be done. And I think there was a different, I guess, atmosphere in terms of decision making, knowing that they need to really sit down and speak to third sector, to the community, and make sure that, as we spoke, as colleagues just spoke about now, thinking outside the box in terms of problem solving and creating some of those solutions. And so I guess this was by far an amazing opportunity for us to demonstrate that. And so there were discussions, just to go into flourishing community, there was discussions with Alison where we wanted to go to the women and ask the women, actually, what are the health needs or concerns that you have? And so there was a focus group that we did. Many women turned up. I have to say, looking back in those sessions, that was really documented in details. There was a lot of lived trauma of what they saw as being unjust, unfair access to health services, and the blockage, and then also some of the areas, if they wanted support, where they wanted us to prioritize. It was a very traumatic listening to some of those experiences around postnatal, antenatal, access to GP, not feeling that they can access GP and have support as equal as other communities in the borough. And I think what we did is told the women that we were going to take that information. Now, as you can imagine, we were quite lucky and privileged to be in that position because we've had a rapport for 19 years, but there was a sense of huge reluctancy of them wanting to feed back to stakeholders because they're fed back so many times in historic consultations and feedbacks where nothing fruitful has come out. And I remember having this chat with Alison. I remember Alison saying clearly that we need to make sure that we keep them at the focus of the journey of this project. So not only do we tell them where we are every time, but we allow them to input and feed back to us. So every step we take is very much about, I guess, what their views, opinions, concerns, or experiences are. And they became the heart or the core of, I guess, Flourishing Communities Steering Group. I will pass it back to my colleagues to continue. Thank you.
Thank you very much, Safia. I think you raised some really important points about how the women have to be the centre of this, and this is what we're working on moving forward. So can we go to the next slide, please? So can you do all of the bits here? Okay, I'm going to hand over, back one. I'm going to hand over to Farah, who's going to talk about what we did with the women.
Fabulous, thank you. So as Safia and Alison have both said, the start, the middle, the end, all the way through this project, it was always going back to the women. It was always changing and adapting as they required, as they told us they needed us to focus on a particular issue of health, or they wanted to approach something differently. And the amazing thing about this project, it was something that was very agile. We were changing it all the way through because we were listening to them instead of deciding how things were going to happen from the start. So this consultation with the women continued from the start and will continue going forward now that there's further funding. In terms of what we did in terms of activities, there were workshops so around health literacy. And one of the barriers we quickly identified is that women that we were speaking to were not accessing some services because they didn't know the benefits. They didn't know why they needed to go for their cervical screening or breast screening or many other health initiatives out there. And so actually we understood, okay, we need to go back and we need to explain and share information in a way that is relevant and useful to them. And that's one of the ways that we can kind of overcome some of the barriers that were being highlighted. So there was a set of workshops that were addressing health issues that, again, the women asked for. And we did also test out some screening programs. So we did put on a sexual health screening program and a cervical screening program or smear testing program, and to see if this community that historically haven't accessed these services would go. And it was really, really good for the short time that we did it. So for example, the sexual health clinic was very successful in the number of women that was able to turn up at a very quick notice, who didn't even know where it was, didn't know if it was them, for them, and also might have felt like some stigma around accessing those services. So there were other learning where we realized something like smear didn't work quite well, because we need to do more work. We need the community to understand why they would attend something like that first. So there's still a lot of work to do, but it kind of showed that with the right information, things could change. One of the key things was this approach of collaborative work all the way through, and that's between the voluntary sector, the community that we work with, but also the healthcare system. So working with the GPs, the PCNs, and all the way through the different groups and services that exist. And also, I think the really amazing thing about this project that we highlighted from the start was we wanted to move away from any particular group feeling like the solution was with someone else. We didn't want the women that we were working with to feel like, oh, the healthcare system or the people working in the system are the problem, and we need this, but we will wait for the change to happen. We really, and same for the system, we don't want the system to feel like the community needed to come to us. So there was this really amazing approach from everyone that said, okay, we need to identify the problems together, but we also need to find the solutions together. And going forward with this project, that's going to be the biggest focus, I would say. Next slide, please. We'll just share an example of some outcomes in the 6-7 months of the project being active. So at a system level, and at individual levels, there was different outcomes that we was able to gain and was able to measure quite quickly. The biggest one is a noticeable increase in the trust, in trust for the system. So straight away when we were talking, so Safia talked about originally having a consultation with the women, and very quickly WIT and CVS were able to see that there was a trust issue. People simply didn't trust what they were being told, how to access these services, that it was for them and that it was in their benefit to go to these services or to access it, or that they would be treated fairly. By the end of it, by speaking to a number of women through case studies, questionnaires, and measuring it in different ways, we were able to see that people were more hopeful, were able to see by the people that were around the table, by the fact that they were involved in the decision making, the trust has started to build. And many women have said, I haven't accessed this before, or I've disengaged from using my GP for a long time, and I've used alternative medicine, for example, but actually now I feel like I can come back and I can benefit. Also, because language was a clear barrier that came up very, very quickly, getting more interpreters that speak the Somali language, that speak one of the key community languages that's needed in this borough, was really important. So the women from our cohort, the women within the program, were signing up to do interpreting courses, to be part of the solution, and for those jobs to be created and for them to fill those roles. Again, something that seems quite small, but in Tower Hamlets, we know this is massive, is the recruitment of one of our ladies from the steering group was employed as the inclusion officer for the primary care group for Tower Hamlets, which is incredible. And now the work that she's able to do to kind of deal with some of the key barriers that was coming out, such as lack of representation, language, all those kind of things, is incredible to see. And I think the impact of that we'll be able to see a lot more as the years go on and as the projects go on. And there are many more examples. Next slide, please. Final one. Thank you. Alison, did you want to finish this one? I feel like
I'll go very
for a while.
I'll go very quickly, so we've only got a few minutes.
Yeah.
So one of the kind of key changes which happened in terms of encouraging employment was for the PCNs to actually start to share their job adverts with us, so that it can be distributed to a range of different organisations, not just the Somali-led organisations. And it's also now, it's been about kind of Somali women being able to join some of the healthcare system meetings and committees, which also then puts the voice of the community central to those decision-making structures. And also that there's greater partnership between voluntary sector organisations. So one of the other bits that we're trying to do is to address the way that voluntary sector organisations are commissioned. Can you, next slide, please? Okay, so these are things, what we're doing at the moment is, as everybody will get the slides, I won't use up your time to read through these, but we're now looking at how this project links with all of the other initiatives which are happening, because the borough is wanting to be a trauma-informed borough. They're also wanting to look at strength, you know, as with all areas, are looking at kind of the transformation around mental health, and also with the setting up of the VCSE Alliance, it's important that we get that representation within the alliance. We're also we're in the process at the moment of consulting on the theory of change, which is on the next slide for people to look at. And this is looking at what we're wanting to change both for the community and for the system. It is, I think there was a comment in the chat that it sounds very much like ABCD. Fortunately, it is a process which is not going to change very much because it is about being embedded with the community and the community being fed back to the whole time. So it's very exciting that we've now got funding for a further 3 years from the lottery. It's not a massive amount of money, but we are looking now at kind of bringing together different communities. So we're beginning to work with the Bangladeshi community, and we're very excited about being able to create a health literacy program, which will be linked into community organisations, into the healthcare system, to sort of support women in their own community languages to be able to kind of have conversations about health and well-being issues, which in some communities are more taboo than others. So thank you very much. I hope I haven't gone over too much.
Thank you so much. That was fantastic. Really, really great to hear. Really inspiring. I'm just going to hand over to my colleague Jahan, because we just want to get a view of everyone's thoughts in the rooms really quickly, and do a couple of interactive activities before moving into our last talk.
Thank you, Sav, and thank you to all of you who've spoken already. What an inspiring way to start this conversation. It's been really wonderful to listen. So I get the wonderful opportunity to engage you in 5 minutes of activity. So just to kick us off very quickly, you'll have already seen a lot of people have introduced themselves in the chat. There is a huge variation in organizations, people coming from different sectors, people coming from different areas of work, and bringing that expertise together with the hope of hopefully forming some partnerships. Now, we hope you'll do some of that today in this session, so please do pop some information in the chat about who you're looking for, who you'd like to partner with, and where you're located. But just to kick us off, we firstly want to know a bit about you. So you will see on your screen now a poll that has popped up to ask you, are you currently working in partnership with other organizations in your local area? Yes, no, or no, but we intend to. So pop your answer in, just vote yourself on the poll. So that we can see, I can see loads of those coming in now, about 80% of you already voted, so pop your answer in. And as I said, we're going to get some more information from you in a second. So it seems like quite a lot of you are already working in partnership, and we love that. So I'm going to give it another 10 seconds, get your vote in if you have not. Okay. So you should be able to see the results on your screen right now. As is to be expected, a lot of you are already doing this really great work, and some of you intend to do it hopefully in the very near future. So just as we move on from this, I'm going to ask you to get your chat ready. So open that chat, and we want to hear from you now. You've already been great at popping some information in the chat, asking questions. What we want to know from you is, what type of organization are you currently working for? And what is the main benefit to having a local partnership? So I've just popped that in the chat so you can see the question. We want you to tell us what organizational type are you from? What type of organization are you from, sorry? And what is the main benefit to having a local partnership? So this might be you already have a partnership. What is the main benefit you get from that? Or if you're currently thinking about starting a partnership, I saw about 7% of you are thinking about starting a partnership. What do you expect to be the main benefit? I'm just going to give you another minute to pop that in the chat. I can see some of those coming in already. Yeah, diverse perspectives and bigger impact. And we've already heard a fantastic example of how that's happening in practice. Yeah, streamlining efforts. And this is such a key point because a lot of great work might be happening in the local area level. But if it's not linked up, then sometimes you can be duplicating efforts. That's a really great point. Right, keep those coming in. Yeah, access to groups that might be hard to reach. And I think this is a really key point we speak about a lot at the Health Anchors Learning Network is, who are you not engaging in your work? And sometimes that can be a really challenging question to ask. Who's not engaged in the work you're doing, in the services you're offering, and how do you access them? Right, keep those coming in. Just another 10 seconds and I'm going to ask you another question. This looks fantastic. We love to hear this from you. Making better use of collective estates, yeah, definitely. So that broader health inequalities agenda in your local area and how you can make a larger impact, fantastic, right? Keep those coming in. And as you're doing that, I'm going to ask you one more question. And this is, again, start off your answer with what type of organization are you from? And I'd like you to tell me one thing you'd want a prospective or current partner to know about working in partnership with you. Now, this might be, as an organization, our values are really important. They have to be at the heart of the work. Or this might be actually something really practical, like we're a really small organization and we need a lot of funding, or we need some extra help to get big projects done. So pop your answer in the chat. I'm going to give you about 45 more seconds. I know this is speedy, but we have some more great examples to share with you for the rest of the time. So another 30 seconds for your answer. So one thing you'd want a prospective or current partner to know about partnering with you. Yeah, it's got to be give and take. I love that, Sue. That's key, absolutely key to getting this work done. And especially when sometimes you're working with smaller partners in a partnership and some kind of larger groups or organizations, it needs to be give and take, right? Yeah, support in spreading the message to colleagues about the benefits of partnership working. Totally, it can be really hard if you're doing the work all the time to lift your head up, and a lot of colleagues that you might have actually hold some of these partnerships in their community already, some kind of connections that might make really fruitful partnerships in the long term. Just another 10 seconds left and then I'm going to move us on to our next fantastic presentation. Okay, keep those answers coming in. We love to hear this from you. So yeah, limited capacity and limited funding occasionally, that can be a challenge. You'd want a partner to know about that. Some of you have mentioned about how much influence you might have in a region, and how partnering could actually bring you slightly more influence as a larger group, accessing more people. Yeah, fantastic. Okay, this is brilliant. So I'm just going to hand back over to Sav. Sav, if you wouldn't mind introducing our next speaker.
Thank you, Jahan. It's really, really enjoyable reading everything in the chat. So next we have Dr. Hinnah Rafique from Generation Medics. Are you okay to speak now?
Yeah, absolutely. Hello, everyone, and thank you for inviting me to share our journey. So I think you need to click next slide, Jahan, to get the text up on that slide. So we at Generation Medics, we're an award-winning social enterprise, and we support people from all social backgrounds, but particularly have a focus on those people who are traditionally classed as kind of underrepresented, or I hate the term, but hard to reach, so that we can help people to explore, strive towards, and succeed in health and care careers. So we are working towards a healthcare workforce that better represents the society that it serves. And if we think about the drivers of kind of why working with the NHS, or why working with Anchors works, well, firstly, I'm a doctor by training, so I have lived experience of the things that I'm trying to, the issues that we're trying to solve. But also there are internal drivers within the NHS on kind of working with VCSE organisations, as has already been kind of explained. So there's like the long-term plan, the people plan. The ICS formation means that there's opportunity there for VCSE organisations. And then when we think about our organisation specifically, we're working towards social mobility, but also reducing health inequalities. So thinking about health being more than just kind of what happens in a hospital or in GP practices, and thinking about the social determinants of health. So that term kind of encompassing things like employment, where you live, the people that you have access to, the opportunities you have access to, and the belief that you can succeed, all having kind of impacts on health outcomes. Next slide, please. So how we actually do this in practice is we work with a variety of different groups, and we call it a virtuous circle. So we work with children as young as 5, and you can see on here the different age groups that we're working with, but we split our work into 3 core themes. So the first being inspire. So we seek to inspire people to believe that they could succeed in any career, but then also telling them about roles available within the NHS, which is the largest employer in the UK, and the wider kind of health and social care sector. So we have a massive unfilled vacancies, and wouldn't it be fantastic if local organisations could recruit locally? So we've got local people getting into employment, and we're creating a sustainable workforce. Well, that's what we're helping to do. So when we look at the kind of work we do with children and the kind of 13 to 25 age group, it's really kind of, let's break down barriers of what a surgeon looks like, of what a nurse looks like, of what a midwife or a paramedic looks like, and get them hands-on thinking about, actually, away from my day-to-day life, this is something I've never tried before, but I actually find it fun, or I'm quite good at this, and what roles are available. And then taking it a step further and then saying, well, actually, for those who do think that this might be something of interest to them, we're able to then continue to support them on their journey. So whether it's decoding exactly how you get to where you want to go, or whether it's just hearing from someone who's a relatable role model, who looks and sounds like you, who's got your kind of local accent, talking about working in a local hospital or the local kind of social care organisations, and explaining what's and all this is what's involved. And then I said it's a virtuous circle. So actually everyone who's kind of further along the line gives back. So if we kind of move into those who are in training, so either undergraduate students or apprentices in training, they continue to kind of give back to the younger people within our organisations, so that they can kind of give their advice of how they went about doing it. And then kind of finally thinking about professionals. Well, if you're from a non-traditional background, there is almost a ceiling within health and social care of how far you can get. And I don't believe that anyone thinks that's right. And so what we're doing is trying to create a new person's network to kind of get over what used to be the old boys network. And we're doing this by kind of investing in the alumni network that we have, supporting local communities to kind of explore the roles and opportunities available for people. Next slide. Thank you. So there's so many examples that we could give of the work that we do across the country, but I'm going to focus in on 2 for this presentation. So one is an adult programme that we started as a pilot, actually, in partnership with a housing association up in the northwest, a small town called Holton. We piloted a programme together with the housing association to support residents who were unemployed, and basically tailored the work that we had been doing for over 9 years that had been focused on kind of 25 and under, and actually expanded it out to support adults. And it went really well. And on the back of that, we were already working with a particular NHS trust, told them about this programme, and we put in a joint bid together, and we got funding from the government to actually support local recruitment. And you can see on this diagram kind of the different ways in which we, as Generation Medics, supported the participants through this programme. So firstly, thinking about that inspire, section, well, actually we need to engage people who perhaps haven't traditionally engaged with the hospital before. And I think, as other speakers have said, there's something of benefit having a separate organisation who's like maybe an arm's length away from the healthcare system itself, because if you've had bad experiences, you might not want to engage directly with them, but by engaging with like a third party who's like a trusted provider in the local area, we've been able to get to people that wouldn't otherwise have had access to this stuff. And then as part of our programme, we've got a skills mapper, which has taken years to create, and it's fantastic. You can use kind of previous experiences, whether it's lived experience, volunteer experience, or previous work, even if it's in a different sector, and we map it to roles available right now within health and social care. And I'll be honest, one of the biggest pieces of feedback we get from the people that we work with is actually they just need the confidence, and that's where the empowerment comes in. The confidence that they've never heard of this role, but actually the communication skills, the team working skills that they have could easily be adapted and translated to a role within healthcare. And then the roadmap, kind of taking it a step further, if you realise that you could be working in health and social care, how do you go about doing it? Well, here's an A to Z guide of absolutely everything you need to know, including the kind of follow on from the role that you're going to be in. So what's the next step? Don't stagnate in that role. Think about your future. And then practical support around applications, so interviews, CV writing, etc., is included as part of that. Next slide, please. So Andy is a 57-year-old participant who was part of this programme. He'd been experiencing homelessness for over 4 years when we met him. He was actually the first adult to be recruited onto this programme that we did in conjunction with the NHS. And he's now successfully in a role as a porter in the local hospital, and that was his dream job. He's in stable accommodation, and we have transformed his life. So it's helping him to believe that he could succeed, and then giving him all of the practical support that he needed to get there. But we're not stopping there. It's that continuous support. So helping him to be able to progress and move on, not only will support him, but also his family and the local neighbourhood and community. Next slide, please. So another example of a project that we did with an anchor is actually supporting young people. So having a focus on, well, a hospital that didn't have a lot of students who were from the local area taking part in things like work experience. So we engaged all of the schools in the local area. We got them involved with kind of volunteering, work experience, and the virtual healthcare academy that we had. And we were kind of really supporting those who perhaps didn't tell their careers advisor that they were interested in this. And so this young lady was an unpaid carer, kind of supporting her mother, but actually through our support, she realised that she could become a paid carer. And before we kind of got involved, she didn't actually think that there was anything more to life than, well, I just need to finish school and then continue to support my mum, and I'm going to go on to benefits. There is so much that we can do whilst working together. Next slide, please. So one of the things that I was asked to kind of talk about is the benefits of VCSE organisations in working in partnership with anchors. And I think there is a mandate to do this work, which is really important, because it means actually there are people within trusts who do want to hear what we're doing, so do reach out to them. And I think, as previous speakers have alluded to, you know, working with VCSEs, we can pivot, we're much more agile. Actually, we've got deeper connections with local communities, and we're able to leverage those to create a greater impact if we can work together on the strategic priorities that are important. Right, that's my alarm. Can we go to the last slide, please? Thank you. So my reflections of us working in partnership with anchors. So some advice for the healthcare organisations and for VCSE organisations. So I think, as others have said, partnerships do require investment on both sides, and there needs to be that respect of each other's time and resources. So you need to spend time getting to know each other and being honest about what you're able to do. And I think being able to coalesce around actually what is your common goal will help, so that even if strategic priorities change, you're able to say, well, this is what we agreed, we're working towards this common goal, what can we do to move forwards together? Things won't be easy, and it will take longer than you think, but actually collaborating to problem solve has always worked out for us. So that's it from me.
Thank you so much. I think it's been absolutely fascinating to hear from all the speakers. I feel just really grateful to you all and humbled for speaking today. We've not got much time for questions, but let's do what we can. And what we can do at Helm is record all the questions everyone's asked and try and get some written answers from the speakers today, if they'd be willing, and send that out in a blog afterwards. So two questions kind of stood out to me that people asked. So we'll try and get through those two before we end today. One is about impact. Someone wrote, how can we measure the impact of voluntary sector work in a way that the ICS has recognised and respect, but bridge this with people's genuine experiences on the ground? So, Hinnah, I can see you nodding. I wonder if we should come to you first.
Oh, I'm an active listener, so I will nod through a lot. But yes, in terms of impact reporting, I think, again, it goes back to the strategic objectives of the ICS and kind of being really clear about what the common goal is that you're working towards together. I think that really helped us. But as a social enterprise, and I'm sure as charities as well, we all know that there's that wider social impact that we all have. So we internally will continue to document that, even if it's not of massive interest to the ICS, we still report on it because it's important.
The Flourishing Communities team, would you like to add anything?
Yeah, what we're working on, and we know that there's already a lot of resources out there, so we're kind of starting to sort of map what resources there are to actually measure the impact and to look at how people tell their stories. So what we're wanting to do is to enable a lot of the smaller grassroots voluntary sector organisations to be able to collect data in the same way, so that if through this project we kind of create a system for voluntary sector organisations to be able to put their data in and to then be able to pull it out, we're then also going to be sharing that with the kind of Health Watch, who actually run a repository, so that there's a centralised place for that evidence to be collated, and that people can then utilise that when they're looking at their kind of funding proposals or when they're putting things forward to the ICS. And we're hoping to get that kind of across a range of other areas within the ICS area. Didn't mean to say area twice, but yeah.
The only thing that I would add, Savannah, is that I guess evidence, we often say evidence is really important, because in order to even start a project, for a project to be funded, it's key. But I think because we've got systems that haven't allowed some of those data of ethnicity and need to be captured, we find ourselves in a position following, I guess, the understanding that some communities have been not supported. So I think we need to really understand that, yes, we need to measure, I guess, the impact, but the systems that we've had before haven't enabled us to do that. So we've got to really think outside the box in order to make sure that we understand the needs of the community. And I think I also say that actually, the ICS or anyone else, we need to be creative in the way that we digest that. As an organisation, we're working towards, telling the story better, using case studies, trying to collect information creatively. And I think for our project, I would say Queen Mary's University was a big tick for many stakeholders, because they were involved in developing and capturing and enabling us to write that impact report. And yes, I think a lot of people were very open-minded to, I guess, the piece of work that we had to do. But I have to say, as a community, we need to understand that ultimately it's about the individual, I guess, outcome, which we need to really measure, because we don't have systems in place. And of course, we need to improve systems moving forward.
I think there's a lot of agreement about what you just said in the chat. Someone's put, does the voluntary sector have to align with the ICS, or is there a need for the ICS to change the way they measure success? Thank you. And Alison, if you have work that you'd like to share with us, we're always going to be happy to promote through our newsletter, etc. Emma, I'm going to come to you next, and I wanted to ask firstly if you want to comment on that conversation, but also there's another question that I thought you might have some useful insight on. Someone has asked, how can we avoid defaulting to working with those voluntary sector organisations who we know, and as such continuing to embed existing inequalities?
Thanks, Savannah. Yeah, I'll just very quick pick up on the previous one about impact measurement, because I think a lot of the time we try and put the voluntary sector into one box as if you all do the same thing, and you don't. It'd be like us trying to measure the ambulance service in the same way we're trying to measure a GP. It just doesn't work. But there's loads of examples of good practice out there, and I think some people have been putting some examples of those in the chat. And we've specifically asked the King's Fund to do a piece of work for us, which is nearing its end. So we will shortly be publishing something that talks about some sort of examples of good practice, which we'll definitely share with people. On the kind of how do we avoid defaulting to the organisations we know, I guess that's part of why we tried to work to establish those VCSE Alliances in every ICS area, so that there is a kind of a congregation of organisations that can do different things in that patch. But also, I know that Alex had previously, I think, put the NAFCA website on there, and if you go through each of NAFCA's members, they have a network of all of the local voluntary sector organisations and they can help to coordinate conversations with a range of organisations rather than just going to the ones you know. So I would look at both of those two places.
Great, thank you. I hate to draw this to a close, but we do need to wrap up. So Jahan, if you'd like to start the evaluation, and just as a reminder, we will be collating questions and emailing out answers. Thank you.
Fantastic. So we have loved being part of this conversation. We've loved having you all here. It's been a really interactive conversation with everyone in the audience participating as well. So I've just popped in a feedback form, which you can fill out on the screen. It will be really helpful for us in terms of running sessions like this in the future or adapting these sessions to fit your needs more. Please do fill that out and feel free to pop any more feedback you have into the chat as a comment as well. Just a few more things then before we close out. We love to have you involved. So if you're not already signed up to our newsletter, please do stay in touch by signing up to that on our website. You'll see the website on the screen right now, or email us directly if you have questions or if you want to share some experiences or comments of your own. You'll also find on our website loads of resources and guest blogs as well from other experts, similar to what we've shared today. So please go and have a look if you haven't before. I just mentioned how fantastic this discussion has been. If you want to keep the conversation going, go and find us on Twitter. It's at @Haln_UK. And then the last point before we wrap up is we have a bumper next couple of months into the start of next year with lots of events, one each month. So please do come back and join us for the next ones. And Sav will pop a link in the chat to register for those as well. You can find them on our website or in our newsletters. And the final note is just thank you so much. Thank you to our panelists. Thank you to everyone in the audience. This has been an absolutely fantastic session. I really enjoyed it. We hope to see you back again in the future. Take care, everyone.